Hello, viewers. Welcome to another episode on Dr. B's channel. My name is Dr. B, and this channel is for you. This channel was created to help you have the life nuggets and information that helps you live a well-rounded and balanced life.
Have you ever wondered how your blood pressure measurement is determined? I'll tell you in a bit. And then you understand how hard the heart works and why this is important for the management of your blood pressure. The period of highest pressure is the systolic, and that is when the left ventricle of the heart, that is the lower part of the side of the heart colored red, contracts, pumps blood out of the heart through the aorta to the other arteries. And the period of low pressure is the diastolic, that is when the left ventricle relaxes and allows blood that has been mixed with oxygen in the lungs, that is oxygenated blood, flow from the lungs into the heart through the left atrium. And then it goes down to the left ventricle, it is contracted and pumped out again, and the cycle continues. So this is the work the normal heart does at 60 to 100 beats per minute on the average when the heart is at rest. Let's get back to hypertension.
So today I'm doing some health promotion again, and I'm talking about hypertension. It's not a new word. It's not a new word. You know it. Someone you know has hypertension. But what's hypertension all about? I'm here to just give you the basics, help you understand, and inquire further with your doctor. So if you need management, a management plan can be structured for you. If you do not need management, you can just modify your lifestyle to help you to prevent hypertension, to help you take the necessary actions that would prevent hypertension. If this is your first time on this channel, welcome. Please subscribe and click the notification button. And if you are a regular viewer and you've not yet subscribed, please, if you like the channel, subscribe and click the notification button so you're aware when there is another episode on this podcast. So hypertension, like we call it, is simply high blood pressure. And high blood pressure, just like the name sounds, is based on the fact that the pressure with which blood is flowing through the arteries is higher than normal. So normally, blood flows in our body. That's why we're alive, apparently. But blood from the heart, pumped out of the heart, flows through the arteries to other parts of the body, to the major arteries, the minor arteries, and it goes to all the parts. But the pressure with which this blood is, like bouncing against the arteries, the walls of the arteries, is higher than normal. We'll talk about what could cause it in a moment. And usually we measure this by a measurement, high blood pressure measurement. The diastolic, that's the lower part, and the systolic, that's the upper part. So we have the systolic over the diastolic. The systolic simply is the measurement when the left ventricle of the heart contracts. So it is higher. It's expected to be higher because that's the cycle, right? There's pumping and then there's relaxation. There's a contraction and there's a relaxation. And then the diastolic is when the left ventricle of the heart relaxes. So the blood pressure machine takes the measurement of both the systolic and the diastolic, because you cannot make a diagnosis of hypertension or high blood pressure without the measurement of both the systolic and the diastolic. The normal blood pressure is 120 systolic and 80 diastolic millimeters of mercury. That's usually how that is measured. Now there are variations with age. As we grow older, the arteries also are aging, and other things. And there are classifications. So we have the normal blood pressure, we have elevated blood pressure, we have stage 1 hypertension, stage 2 hypertension. This is the classification of the American Heart Association, but I'm not going into all those details. Just know that the normal blood pressure is 120 systolic, that is the one above, and 80 diastolic, that is the one below. So anything above that is elevated. It might not necessarily be a diagnosis of hypertension yet. It might just be elevated blood pressure. And a diagnosis is not made just based on one reading. A diagnosis is made based on a series of reading before you make a diagnosis of hypertension. When hypertension is established, it means that the heart is working harder than normal. Because remember what I said? The pressure with which blood is, bouncing against the arterial walls is higher than normal. So to keep this pressure going, to keep blood flowing through the arteries, the heart has to work harder than normal. So this will make sense when we talk about some of the complications of hypertension. There are certain risk factors that predispose people to hypertension, and that makes us know whether it is primary or it is secondary. From the name, secondary hypertension is hypertension that is due to something else. So someone can develop hypertension because they had diabetes, or someone can develop hypertension because they were on a certain kind of medication, or someone can develop hypertension because of kidney disease. So that is secondary hypertension. But primary hypertension is based on that individual's probably lifestyle, genetic factors, environmental factors. Like every other disease, it is contributed to by genetic and environmental factors. And I would always say, check your family history. So if there's a family history of hypertension, there is the chance, the probability is higher for that person than the general population to have hypertension. So when you know that, it helps you to modify the environmental factors. Remember, environmental factors are things that you can sometimes control, especially the social and economic factors. Some of them are within your control, but genetic factors might be outside of your control. So you can modify what you can modify to prevent you from having hypertension. Other risk factors are alcohol consumption. Sedentary lifestyle means a life that is very inactive. So a lot of sitting down, being driven around in a car, sitting down in the office, not doing much with your body. Your body needs some good movement, and that good movement should be exercise. It's not just movement that is stressful. It should actually be good movement, and that is exercise. Another thing that I want us to know at this time is sometimes, and that takes us to management, hypertension can be managed very well. And management of hypertension will be decided by your doctor and your care team on what works best for you. So hypertension is not always, you need to be on medications. It's not always the case. Sometimes, yes, that is the management protocol for that person. But depending on what your care team finds out, they decide and recommend what is best for you. But there are things that always go alongside, even if you have to be on medication. One is exercise. Exercise is important for you to prevent and also to manage hypertension. And if hypertensive, the recommended exercises are isotonic exercises. They are exercises that do not necessarily aggravate an existing condition. So a brisk walk, for example, is an isotonic exercise. Swimming is an isotonic exercise because there are some exercise and the intensity of the exercise might actually not be very good for you if you are already hypertensive. Another key factor in prevention and in management is diet. Low sodium diet is recommended for everyone. We shouldn't be consuming too much of sodium because high sodium diet is actually a risk factor. So reducing the sodium level in diet is very helpful for both prevention and also in the management of hypertension. And like I said, there are anti-hypertensive drugs that your clinician will recommend and your care team will recommend should there be a diagnosis of hypertension. Now, hypertension does have some complications. If hypertension is not picked early or managed timely, or the person is already diagnosed and is not compliant with the management plan, there could be complications, and that's usually what leads to the development of a stroke or a heart attack or a kidney shutdown because the kidneys can't cope anymore. There are other end organ damages that could also happen when there is complications of hypertension, and this is what we want to prevent. So take care of your health. Make sure you make the right decisions. If you are already hypertensive, please adhere to your management plan, your diet, exercise, and your medications are really, really important because you can still live a long and full life. Stop running from pillar to post, looking for alternatives, because unless you are really sure that those alternatives are helpful, they might actually be harmful to your health. So until the next episode, I remain Dr. B. Remember, your health is your greatest asset. Take care and bye.